Hello, this is Dr. Do again. This video is continuously from previous video, systemic approach of medicine. Basically, I have repeated so many times this series of video laying out like structure-wise connected to the what we have in the body from organic compounds and associated diseases, and also cellular level, tissue level, organ system levels. I'm on the cardiovascular system or circulatory system. First of all, in the circulatory system, I'm starting with the cardiovascular component and then move on to the blood. So I have talked different diseases or clinical presentations associated with this cardiovascular system. Today I'm going to talk about another not common but could occur, depends on what age group we're talking about, the syncope. I'm going to focus on the syncope caused by the heart problem. I think I have previous video talked about the syncope. I think that's focused on the variety of causes, either vasovagal reflex cause the syncope, or dehydration, or stress, or neurological cause syncope. But today I'm just going to focus on cardiovascular cause of syncope. First of all, like the risk factors, and also how to prevent those syncope, and what the signs that you need to see your physician or your emergency to prevent the further or the future syncope. So first of all, let's just bring up the syncope. What is syncope? You probably know it, just lost consciousnness. Like I mentioned, it could be caused by many either organic diseases or just the imbalance of the autonomic nervous system, like the vasovagus. The balance in the body, by the way, is a lot of time, particularly the internal organs. It's dual innervation, which means there is sympathetic nervous system and also the parasympathetic nervous system. Sometimes if the parasympathetic, like the vagus nerve, is hyperactive, cause this temporary loss the consciousness. So that's not the I'm going to focus. That could occur in anybody, normal, without any cardiovascular problems, young or old. But for the syncope caused by the cardiac causes or cardiovascular causes, I think the main cause is the arrhythmia, variety type of arrhythmia. Talking about the arrhythmia, I'm just briefly to talk about the structure. How is the heart rhythm regulated and conducted? There's a conductive system, cardiac conductive system. Basically, I think I mentioned before, from the pacemaker, that's where the rhythm generated. Through the mechanism, physiological mechanism, is like the electronic current by the movement of the ions, either potassium or sodium or sometimes calcium, move across the cell membrane, generates the electric potential. That potential amazingly can generate the signal. And this pacemaker signal passed down, it's located at the sinus, okay, and passed down through the branches and also the bundles and to the atrium and ventricular muscles and back, and then this is how the rhythm, the rate of rhythm passing down through the heart. So this is a continuously circles. If any of this pathway had a problem, either from the pacemaker or from the conduction system, will cause the anemia, either from structurally diseases of heart or non-structurally diseases of the heart. What that means like ischemia, for example, there's no abnormality of the structure, but sometimes hypertrophy causes the myopathy, cause the subvalvular obstructive cardiomyopathy, for example. That is structurally wise cause this arrhythmia. So having said that, what are really the cause of syncope from the heart problem? What kind of arrhythmia can cause the syncope? Either too fast or too slow, any of them. Supraventricular tachycardia, for example. It's quite common. Could be in those people who had diseases or cardiac problem, or normal people can have this paroxysmal, which means sometimes just occasionally have that episode, supraventricular tachycardia. If it's too fast, it may cause the syncope. And also any other cause like AFib or flutter, the heart rate is so fast, or tachycardia, ventricular tachycardia, that's very dangerous. Usually, if there's a ventricular tachycardia, you probably know the VTAC. If I say ventricular tachycardia, probably not as easier as to catch it, the VTAC. That's life-threatening situation. There's, regardless if that's the case, I think it's very dangerous. So this is about the one type of arrhythmia, which is increased heart rate. On the other hand, the bradycardia, any type of bradycardia from the blockage, in terms of the cardiac blockage, there's any during this pathway of conduction system, if there's any blockage, may have this risk factor of the syncope. Regardless, there's if I talk about the heart blockage, there's different degrees, different classifications, but regardless, if the bradycardia causes the syncope, then you need to see your physician. Sometimes, by the way, we live with this bradycardia or heart block, particularly for the mild, the first degree heart block. A lot of people just live with it, but monitored under the physician, closely monitored. Make sure it's not progressive to the further degree, like second degree or third degree, which are a majority of cases of pathological, has to be monitored or managed. But so if you have the bradycardia, your physician told you you have bradycardia, you have first degree, for example, heart block, then if you had syncope, then I think that you need to talk to your physician. If that's the sign, something you need to be not just the monitor, has to be treated to prevent further episode of syncope. And so this is about the bradycardia, the slowing heart rate causes the syncope from the heart problem. These are non-structural diseases, but this is there's another, like I said, the structural abnormality from the heart can cause this syncope. I think one of the typical is used to be caused like a hypertrophic cardiomyopathy. Now there's a new term for it's a subvalvular obstructive cardiomyopathy. Regardless, the different causes just means the heart wall is just undergoing hypertrophy, too thick, too big. If you imagine that's just too large, then block the valve. So there's no space for the valve to open, just like the door cannot open because of this, the wall is too thick. So that's why, and that's the other cause of this syncope. So this is about, in terms of treatment, I think there's no treatment, has to be the transplant, that's the option. But regardless, so the syncope is really, if it's caused by the heart problem, either with previous heart disease and also the structural abnormality. So if that's the case, you really need to follow up with your physician regularly to make sure not progress to worse or deteriorate. I'm going to stop here. Thank you for watching. I'll see you next time.